An ankle sprain is probably one of the most overlooked and most inadequately treated injuries that I see in my office. It is estimated that 1 out of every 10 visits to an urgent care facility is for an ankle sprain. Many people falsely believe that all types of ankle sprains are mild injuries that can get better on their own with some rest, ice, elevation, and ibuprofen. But that's a mistake. Based on the severity of the ankle sprain, proper treatment must be rendered to avoid chronic pain and instability of the ankle down the road. So what exactly is an ankle sprain? An ankle sprain is an injury of the ankle in which a sudden fall, hit, or twist of the ankle results in either overstretching or breaking of the ligaments that stabilize the ankle on the inner and the outer side of the lower leg. The most common symptoms of an ankle sprain are pain and swelling. If there is any bruising with black and blue areas around the heel along with trouble walking, there may be severe damage to the ligaments and possibly even a fracture of the ankle bone. These types of signs and symptoms need to be evaluated immediately at a healthcare facility with an X-ray and need aggressive treatment so that ligaments and bone can heal. Ankle sprains are graded and treated according to their level of severity. Grade 1 ankle sprains are mild injuries in which ankle ligaments get overstretched but don't break. Once properly diagnosed, these types of mild sprains can be treated simply with rest, ice, elevation, and a compressive elastic ankle support with some over-the-counter pain medications. Grade 2 and Grade 3 ankle sprains, on the other hand, involve extensive damage to the ankle ligaments, such as a partial or complete rupture of the ligaments. Tear of the ligaments can cause bleeding under the skin, resulting in bruising and significant pain upon walking. These types of severe sprains usually require some form of immobilization for up to 4 weeks to stop the motion of the ankle so that the damaged ligaments can heal and tighten up again to stabilize the ankle. Once the area heals, aggressive physical therapy can be initiated to strengthen the muscles and the ligaments around the ankle. If proper treatment and rehab is not rendered for Grade 2 and Grade 3 ankle sprains, there is a high chance the ankle may become weak and can be re-injured again. Lack of adequate treatment may start a cycle of repeated ankle sprains, resulting in long-term problems such as chronic ankle pain, arthritis, and chronic ankle instability, which may then require surgical intervention. So the key to getting a successful outcome in the treatment of an ankle sprain is to determine the severity of the sprain and then to treat it in a timely manner. Delays in treatment of an ankle sprain make the full recovery more difficult and longer. So if you have any ankle pain after an injury, please contact our office immediately. We will see you on the same day, diagnose the level of your ankle sprain, and offer you a comprehensive treatment plan.